Jennifer Enger. I work for Mid-Hudson Veterinary Practice. Thank you for coming today for our discussion on equine emergencies, what you can do while waiting for the vet to arrive. We're going to discuss a few of the basic equine emergency phone calls, and this talk is also sponsored by the Lewisboro Horsemen's Association, and we express our gratitude to them today. We hope you enjoy the lecture, and we thank you for coming. The equine emergencies we mostly want to talk about today are basically four categories that we see most commonly, and that's choke, colic, wounds, and eye emergencies. And the reason why we chose those four also is because they are also the ones that you can sometimes do a little triage work while you're waiting for the vet to arrive. Some of the more catastrophic emergencies that occur, knock on wood, infrequently, there really isn't that much that you can do while you're waiting for the vet to come, and so we won't really go over those. We're going to go over the ones that there are some things that you can do while you've already called the vet and you're waiting for the vet to arrive. But obviously, the topic of emergencies can cover a pretty broad range of possibilities. We mostly want to discuss what you can do either before you call the vet or while you're waiting for the vet to arrive. And most of those things are sort of common sense, but not everybody thinks of them when they're undergoing a fairly stressful situation. So obviously questions like attitude. Is your horse bright? Is he quiet? Does he appear to be in pain? Does he seem to be oblivious to an obvious painful wound that you can see? Obviously if your horse is colicking, then he's going to appear to be in pain, but we certainly see some wounds that are mere soft tissue injuries, and the horse is really fairly oblivious to them. He just is eating, is walking normally, is otherwise acting normally, but has a skin injury. Is your horse lame? Did you take your horse's temperature? If your horse is lame, is he significantly lame? Is he mildly lame? What does your horse's gums look like? Lift the lip and try to give us some idea on the phone if they look pale to you, if they look fairly normal and pink and moist, if they look purple, a color that you're completely not used to seeing. Do they look bright red, like beet red? Obviously also a color you're probably not used to seeing. And then are the front feet warm? If the horse is lame on a single foot, is that foot hot? Compared to the other foot, which could be cold or lukewarm. And then here's a topic that we're probably all going to cringe, but know how far you're willing to go with that horse. It's a difficult discussion to have, either with your husband or partner or with your boarding stable manager. Just have some idea whether or not everybody's on the same page that this horse is 29 years old and he's not going to go to the clinic. Anything we can do at the farm is wonderful, but we're not getting him on a trailer to go anywhere. We're going to say goodbye before we do something of that necessity. Also knowing where to go, how far you're willing to go with your budget. So these are difficult topics to talk about, but sometimes talking about them openly and honestly before an emergency occurs allows everybody to just be on the same page and just know that some things are within the budget and some things are not, and try not to be embarrassed by either that discussion or the limitations of that budget. And then the third point of this slide, which should probably be one of the first points of this slide, is if you do not own a trailer, please don't hesitate to ask us or ask friends for phone numbers and contacts to save in your phone, because in these cases of emergencies, trying to think of somebody's name, that lady that's always at the barn, I can't think of her name, who has a trailer, save them in your phone under the word trailer. Don't try to save them in your phone under that person's name, because in a pinch you will never think of that name. Murphy's Law says, if you save it in your phone under the keyword trailer, then these names will pop up, and then you can stop and think whether you need a small trailer, a large trailer, a trailer for a mini, a 2-horse, a 6-horse, or whoever's closest, no matter what size trailer they have. Saving these things in your phone, obviously many times once the vet gets there, we'll have a few of those numbers as well, but you may come across contacts that we're not aware of that could be closer geographically to you in emergency. So prepare an equine emergency kit. We make them in our practice. We have one to raffle off today. We certainly have clients that have made their own out of, a tackle box from Home Depot. It's certainly easy to do, and we'll go over in the next slide some of the basic components of an emergency kit, and we have tons of clients in the room even who have an emergency kit at the barn and they have an emergency kit in their trailer. So when they go, whether it's hunter pacing or 3-day eventing, they're basically off the premises for a while, they still have a contingency plan. And having that kit organized and knowing what's in it or what you used up and needs to be replaced in it is obviously a little to-do list you can make for yourself. This is what we put in our first aid kits, and for the most part, the thermometer, of course, is top of the list. You should probably put 8 of them in there because of the way they disappear and people borrow them. And we usually use a standard mercury thermometer because they're very dependable. We have tons of clients who like the digital ones, and that's fine. It doesn't really matter. Any thermometer will work in a pinch. Sometimes just knowing whether a horse has a fever or doesn't have a fever is a big box to check off when you're speaking with the vet on the phone or before you even call the vet. So we put a 1 ounce of Xenodyne is a brand name of betadine solution, so it's a wound cleanser. Furacin is an antiseptic. Hudson K are these little tubes of soft tip applicator antibiotic that were originally made for cattle with mastitis. And we usually use them for puncture wounds, wounds in the foot, just because they have a very soft tip applicator, and so it's easy to apply into a puncture wound fairly, without a dramatic amount of pain. We also use them in the foot with severe thrush. We'll often treat the foot with Hudson K and wrap the foot. So vet wrap and cling bandage are, of course, on the emergency kit list. Dexamethasone is a medication, so that's not going to be over the counter. That is a corticosteroid. We often use it for severe respiratory distress, so difficulty breathing, also severe bee sting attack, bee attacks, or a horse that's covered with hives. Sometimes nothing will bring down those hives, but a decent wallop of corticosteroids. So a box of adhesive bandages. Non-stick Telfa pads are basically sterile gauzes that are non-stick, so that is often the first layer to apply to a wound that is not bleeding significantly. An ice pack or a gel pack is great to have, especially when you get to the barn and you open the stall door and your horse's eye is swollen shut and it looks like somebody took a baseball bat to your horse while you were gone. Sometimes a good cold compress, whether it's actually frozen or just very cold, will bring down that swelling pretty quickly until you can see, the actual globe of the eye or the cornea and get a good idea for whether this is all soft tissue, assault and battery, or his actual eye is injured. Bandage scissors, of course, are great. A dosing syringe, sometimes you have to give the dexamethasone powder orally. If the horse isn't eating or can't eat, sometimes you have to add that to warm water and squirt it in his mouth with an oral syringe. And a 10 ml syringe or 10 milliliter syringe is for flushing a wound or even just flushing a foot with water from a water bucket, just to have a little force behind it. The syringe can apply a little mini power wash. And then we have 4 little antibiotic single-use topical ointments, and we have a little tiny tube of triple antibiotic eye ointment, because there's never a downside to using that. And we'll touch on that topic again when we get to the eye emergency slides. And then alcohol wipes are great. Some clients like to use an alcohol wipe before they give anything injectable, or sometimes just cleaning an area to see if it's bleeding or if it's blood dripping from somewhere else. Alcohol wipes can help. Gauze pads, of course, you want to get a quick handful of a stack of gauze pads to apply direct pressure to a wound. A weight tape is a great idea to have in your emergency kit just to get a ballpark. If for some reason, it's the middle of a winter storm and the vet for some reason can't get there, or your driveway's not plowed and there's no access, giving the vet on the phone some idea of how big is your horse, what size pony are we talking about, is it a large pony, can you just drape a weight tape around him really quick so we can figure out how much Banamine or how much bute that animal can have. We have little vials of insect sting relief. Some of the items in this emergency kit are for you, and there's no reason why you can't use them yourself if you're out trail riding. Or, yeah, we don't include Valium in the emergency kit. You can always put a bottle of vodka in there again. It's a little unbreakable. So some of the items in the emergency kit can be for human use. Let's clarify. Not the dexamethasone, not the Banamine, and not the Bute. So if everybody's familiar with what Banamine is in the room, Banamine and Bute are both non-steroidal anti-inflammatory drugs. Banamine is a little stronger at soft tissue pain, so we tend to reach for the Banamine in occasions of colic, eye swellings, eye pain from a corneal scratch or a corneal ulcer, wounds, whether they need to be stitched or not, typically respond to Banamine as their pain reliever. Bute is more of a bone pain, joint pain, muscle pain reliever, and Bute is the stronger of the two as a fever reducer. Although Banamine comes in injectable form, we often give Banamine IV when we see a horse with a fever because it acts quickly and we can give it IV. Bute is oral, and so it takes time for Bute to work, although Bute is the stronger of the two at holding that fever down for a longer period of time. Banamine you can administer more quickly. So things that you guys can add to your own emergency kit if you're making yours or win ours is either a shallow feed tub or a bucket for soaking a foot, because those also disappear unless you Sharpie your name on them. A flashlight or a headlamp is a great idea for your emergency kit because sometimes you just can't see, even if the barn light is on, you can't get a good idea of how deep a wound is or how deep a nail penetrated foot or what have you. And a headlamp is even better because then you still have two hands. Tweezers, SWAT is a fly repellent ointment to put around a wound to keep flies away from it. Eye cleanser, and we have on here saline contact blend solution, of course is a good idea. Except just take a look because some of them are made with boric acid, and that can be a little bit stinging to the eye, although it is saline. It usually has a little boric acid added to it for cleaning your contact lenses, and so sometimes that burns a little bit if you try to use it in your horse's eye. A soaking boot or some other method of soaking a horse's foot is always a good idea too. Any kind of poultice, we tend to use Epsom salts, but other products are like Magna Paste or Poltex or Animal Lintex. Those are all great. Obviously nitrile gloves or latex gloves, an extra halter and lead rope or a twitch, things like that where you just want to know where they are because when you need them usually pretty quickly. Duct tape, of course, we all live and breathe with duct tape daily. Diapers are great, and maxi pads are on the list too because diapers and maxi pads are really cushioning, and if you need to treat a hoof wound and you really need a fair amount of cushioning before you wrap that foot up, those are great to have and they're pretty easy to use. Ictamol is another poultice type ointment, especially for poulticing a foot abscess, and clay poultice is another style, especially for bringing down a swollen leg. Obviously shoe pulling equipment, if your farrier has some items that he's retired from his box, you can always ask him to think of you when he's going to throw some items out because sometimes they can be sharpened or retooled and you can still use them to pull off a shoe that's hanging off. It's certainly better than nothing. And then brown gauze or something to wrap a tail. If you have a wound anywhere on the rear end of a horse or a hind foot, sometimes wrapping that tail to keep it out of the wound or keep it from flicking shavings around is helpful. And then any extra double-ended snaps, triple antibiotic ointment or bacitracin ointment are great. And cortisone cream, even just 2% cortisone cream for a bad bee sting or a bad spider bite. You could take that stuff on and let it sit for a while. So the first major topic we want to talk about for horse emergencies is sudden lameness. And so this is a great picture of a horse in surgery at a healing. This wound it's already a healed photo of a wound on the back side of the hock. But you go out to your barn and your horse is acutely lame. He's practically non-weight bearing lame. So some things to find out before you call the vet are obviously how lame is he? Can he walk on it without you really having to prod him to move forward? Can you see a reason for that lameness? Is there hair missing? Is there a wound? Is there an impact mark or a big swollen area so it looks like some somebody kicked him or he ran into the fence? Was your horse sound 1 minute and then crippled the next minute? Where, this happened overnight, or it happened over the span of a 2-hour run to Tractor Supply. Have you checked your horse's foot for a nail or foreign bite? Did you try picking up the foot, pick it out, see if there's anything in there, even pieces of glass? We've found nails, screws, pieces of glass, random pieces of metal. You'd be surprised. So is any part of that horse's leg swollen? If he's so lame on it, is there any obvious reason why? Does your horse have a fever? Many times if there's a wound or the horse's leg is swollen and there's a fever, you can already get a feel for a time frame there, because it takes a while for a horse's body to mount a fever. It doesn't mount it right away. Infections don't occur right away. They take time. So many times you can gauge a time frame by whether or not the horse has a fever. Are there any scrapes or cuts on your horse's leg? Is there any evidence of assault and battery, either from another horse or from horses getting rowdy over the hay? Or did your horse work extra hard recently that your horse would be having some muscle cramping or exhaustion? So when we hear clients call and they say, my horse is non-weight bearing lame and he was fine yesterday, we typically think of two things: fracture or foot abscess, because those two things have such a dramatic amount of pain associated with them. One, because it's an infection caught in the finite space of the hoof wall, and the other because there's a bone fracture, and bone pain is such an unrelenting, mortal style of pain that either one of those could cause a non-weight bearing lameness. So if you believe your horse has an abscess, then many times there is no wound. The horse's leg might be swollen, but there's no scrape mark, there's no hair missing, there's no impact site, there's no hematoma or blood blister, and the foot is raging hot, and the horse had shoes 10 days ago and was perfectly fine until today. And so many times those are all history points that are basically showing you that the likelihood that this is a foot abscess is very high, as opposed to a fracture where there should be some sign of some sort of trauma, either trauma to himself or trauma caused by something else. So we typically recommend with foot abscesses that you soak the foot. We don't use anti-inflammatories or antibiotics too quickly, because this is one of the few times in the horse's life, and strangles being another one. And if you think of the common denominator being that they both form abscesses, then it makes perfect sense. You really want the body's inflammation to form that abscess and then bring it out to the surface where it can be accessible to us, either to lance it open or to use hot compress and treat that and open it and drain it. And as soon as those abscesses open to the outside world, there's a huge amount of pain relief with that. And so the horse is usually significantly more comfortable once that abscess is draining. So we try not to give either bute or banamine unless the horse really direly, desperately needs a little bit of help, just because it makes the abscess take longer to form, and it makes everything take longer. So we recommend soaking the foot in hot water, as hot as your hand can tolerate, bringing that water level up over the coronary band, basically softening up the skin. And then many times if there's a shoe on the foot, then the shoe needs to be pulled either by the vet or the farrier. We always recommend you contact us to come and see this foot. Many times if the foot abscess is at the sole of the foot, we can find the abscess with a hoof tester, and we might be able to lance it open and provide drainage right away. Some of them take a long time. They're processing that foot abscess upwards against gravity to the coronary band, and those take longer. They're usually associated with a larger amount of swelling of the leg, and so those require a lot more hot soaking and a little more in the way of nursing care, because you can't just lance those open at the coronary band. There's a huge amount of blood supply there and a lot of damage you can do. So the last point on the slide goes against every reflex in everyone's body in this room. So if you pick up your horse's foot and you see a big honking roofing nail sticking out of it, you really have to take a deep breath and try to resist the urge to pull it out. So Obviously, if your horse is in a huge amount of pain and you can't possibly keep him under control until the vet can come, then go ahead and pull it out. But we ask a couple things. A, try to mark the nail with anything. Anything you have in your pocket, even if it's your lipstick or your lip gloss or your chapstick or a piece of tape, just wrap it around the nail so you know how much of it was sticking outside the horse's foot. So if you go ahead and pull it, you know exactly how much was inside the horse's foot. Otherwise, if there's any way to accommodate your horse, drag a bag of shavings or a hay bale right into his stall, flex his knee and lay his knee on the hay bale and stand there and feed him if you have to, till the vet comes. And try not to pull it out, because many times we can x-ray it with the nail in place and see exactly what structures it's touching, what structures it's accessing or penetrating, and so we can tailor our treatment to exactly what we think occurred. So obviously it's more helpful to have that foreign body in place, but sometimes you just can't keep them, especially if you're out in the field and you have to get them into the barn. You really need to pull out that nail to get them in. And then we almost always encourage you to try to make a mental note of, if you didn't have anything in your pocket to mark it with, make a mental note of how far you think it was in the foot. This is one of those occasions where we get the fishtails of, it was in his foot 3 inches deep. You look at the roofing nail and it's not even 3 inches long. And so as soon as you pull it out, you lose your entire perspective. So try to get a good, accurate look at the nail. If you whip it out, put it in your pocket, bring it with you, bring the horse down to the barn, plop his foot into some hot water, Epsom salts or not, whatever you have, any clean hot water. Try to make a mental note of whether it bled, whether it didn't bleed, whether it bled like a son of a gun, and where that location was on the horse's foot, because many times you pull that nail out and you cannot find for the life of you where that was in the foot later, because the sole of the foot just closes right over. So other reasons for sudden lameness, here's a great picture of an x-ray of a fracture. Other reasons for sudden lameness include tying up and soft tissue injuries, but those typically are not the non-weight-bearing lame style phone call that we get. Those are more head-bobbing lameness. The horse doesn't mind walking, certainly can walk out of his stall. Horses that are tying up are basically enduring a severe muscle cramp, usually of the hind end muscles. And so sometimes they will be reluctant to walk forward, but it's not because they're lame in one location. It's because their whole body is very stiff and cramping. And then obviously a fracture. Many of the horses with fractures have some history of impact trauma, whether it's by another horse or there's at least some hair missing to demonstrate some sort of impact trauma with a fence or even a jump. So this is a great x-ray, because you would never really see this this is not a compound fracture. You wouldn't see this fracture unless you x-rayed it. And you can see by the outline, the gray outline of the soft tissue of the horse's leg, that his leg isn't even very swollen. Some very catastrophic fractures will start to swell right away. And this one is very subtle, and this one would be surgical or a worse decision than that. So some of those fractures do require surgery, and some of them, depending on the discussion of the budget we talked about before, some of them can heal in a stall with just aggressively significant stall rest, and never take the horse out of the stall, even to clean it. Sometimes those will heal. They'll take a while, but they will heal. So wounds, lacerations, and wounds. You find a wound on your horse, what to tell your vet on the phone? Can you get any idea of how long ago it happened? Any location of the wound? Sometimes that's difficult to describe because horses are oriented to the ground differently from us, and so it's hard to say, it's underneath his chest. Well, is it underneath his chest on the front surface, under the neck, or is it under the chest, meaning it's facing the ground? If it's on a leg, try to describe where it is. Now, in this age of camera phones, we almost all have one. We get texts all the time. This is a wound I found on my horse. Does it look like it needs stitches? And so, you know, it never hurts to do that. Take a close-up photo of the wound so we can see the edges, and then back off so we can see where it is on the horse's body or on the leg. And we can get some idea of whether it needs to be stitched or it doesn't need to be stitched. It's really just a surface damage. And then obviously a big question to answer for us on the phone is your horse lame? If this wound is on the leg, is the horse significantly lame from it, or is it really just a soft tissue injury, a skin injury? And then the attitude of the horse, like we were saying before, is your horse bright and alert and oblivious to this injury, or is it quiet and seems to be favoring the leg and seems to be really bothered by it, and the horse's temperature? So what to do while you're waiting for the vet? We mentioned before, the reason you have gauze pads in your emergency kit is a wound that's bleeding significantly. You don't want to dab at it. You want to grab a handful of those gauze pads, hold direct pressure on the wound. If you can find bandage material and it's in a location that can be bandaged, like on a leg or on a tail or anything that you think you can wrap anything around, by all means bandage that gauze in place. Don't dab at the wound. The way that the clotting factors and the platelets work in the blood is that they are looking for a surface to start building a clot. So when you dab it, you're triggering the clot mechanism, and then you're pulling your gauze away and opening that clot again. So applying gauze and pressure allows that surface of the blood vessel to start closing up and clotting. And then many times when we get to the farm, sometimes all we have to do to loosen that gauze is just use warm water and sort of tease that gauze away. Sometimes it starts to bleed again, of course, and sometimes it doesn't. Sometimes it does great. So you can wrap the gauze in place with either Elasticon or vet wrap because that sticks to itself. Try not to wrap it too tightly, but you want to provide some pressure. And then if the wound is on the rear leg or the hind leg, we were talking about before, and in this picture you can tell the horse's tail is wrapped up because this wound is on the back side of that hock. And it's pretty easy for that tail to start flicking dirt and hay dust and shavings dust into that wound when you're trying to clean it. Even if you're trying to hose it and the horse isn't letting you do much more than that, it still helps to keep that tail out of your way. We ask you not to spray the wound with stuff, whether it's the silver spray, furacin spray, blue coat, wound coat, any of those items before the vet can see the edges of the wound, because sometimes we get to the farm and it has all this caked antiseptic spray on it, and it's hard to tell if maybe once we get all that stuff off, we could stitch the wound. And sometimes time is of the essence with these wounds, and you don't want to damage the edges of that tissue trying to get all this caked stuff off first. So we ask you usually not to spray anything into the wound. And if possible, if you can bring the horse down into any clean, dry, sheltered area, even a run-in shed, if the horse lives in turnout and it's a retiree, just bringing it down into a run-in shed where you can even just have wind protection because the wind will blow all sorts of debris into the wound as well. And then any place with light would be great, but this is where we are going to be auctioning off headlamps and flashlights, because it's great to just have a flashlight in your pocket or a headlamp on your head, and you can get a really good view of how deep the wound is, where it is, can you see bone in the wound, anything like that. It's great. And then obviously in the winter, we try to provide an area out of the wind, and if any accessibility to hot water is a bonus. There's another great gory slide. So raise your hand if you need me to flip forward. But this is a wound right below the knee. You can see there's some wounds above the knee as well that are not as deep. But this wound, you can tell we're not going to be able to stitch because there's just no tissue there to close. And we all know that below the knee on a horse's leg, there's no extra skin. There's no room for stretching that skin to try to make that closure. It would be under way too much tension and usually would just rupture the stitches and do more damage potentially. So many wounds can be dealt with on the farm with sutures if possible, and sometimes just with clean bandaging and bandage changes and just treating the wound topically and allowing the horse's body to heal that wound from the inside out, which we call healing by secondary intention or by second intention, which for you and I we'd refer to as scarring. Basically, be filling that wound gap with scar tissue until it comes up to the surface level. And so wounds with deep tracts, wounds associated with fevers. Remember before, one of the questions we asked you to do is take your horse's temperature. If the wound is associated with a fever, it tends to have a little bit of a worse prognosis because it means a significant infection has already started. And obviously a wound over a joint can be significantly bad news for that horse to maintain his workable life, as well as even just to live out as a pasture ornament. So those are all cases that potentially could generate the discussion of whether this horse should go to the clinic and have that wound treated in a little more of a sterile environment. So a complicated wound will always have a poorer prognosis if we can't address it quickly and aggressively. So depending on where the wound is on the body and whether it can be sutured, those are all factors in getting that wound to heal quickly and not get it infected. So what to expect with a typical wound exam? Everybody knows, and you've seen in those past few slides, that the wound is clipped. We always clip it. And whether or not we need to sedate that horse first to allow that sort of manipulation, it all depends on the horse. We always clip an area above and beyond the boundaries of the wound because we're trying to keep that area as sterile as possible. There's a significant amount of staph bacteria in the hair coat on the surface of even yours and my skin. And so in order for us to scrub that wound and really get it clean and sterile before we try to close it, if we're going to close it, or try to get it clean and sterile before we put a nice clean bandage on it, and we're going to remove it from our visibility for 24 hours, we want to make sure that we removed all that staph bacteria. So we always clip the wound right down to the skin. It's a surgical clip with broad borders, and then we start scrubbing the wound, try to probe the wound and see how deep certain pockets go, and try to flush them out and make sure there's no hair and shavings debris or hay debris in a pocket where we can't see it at the surface. And so, and then usually at that point we decide whether or not we can suture the wound, whether we can get those two edges together. And sometimes some wounds are so extensive that sometimes you can make a decision that part of the wound can be stitched and the rest will have to be left open. But we'll usually try to stitch as much as we can if possible. And the rest will usually be left to heal by scarring, what we were discussing before, or healing by second intention. And wounds on the legs, we usually bandage, of course, whether we stitch them or not. A, to help keep them clean, and B, to try to limit the movement of that horse's leg a little bit, which helps those stitches stay in place until they can start providing some healing. If it's been over 6 months since the last tetanus booster or EWT vaccines, we usually rebooster them just to make sure that tetanus is really current. And then we obviously will start an appropriate antibiotic, whether that's an oral antibiotic or tablet in the horse's food, or if that wound looks significantly dangerous or dangerously close to a joint, or the horse already has mounted a fever, then we might start with an injectable antibiotic just to start getting a very aggressive treatment going. So if we place a drain, which in that previous wound on the horse's neck, you could see a drain there. If we place a drain, it's usually to allow for drainage of a pocket of wounded area or region that is going to fill with fluid, whether with abscess or just normal serum discharge. And we want to provide that drainage quickly. And so we usually take those drains out in 3 to 5 days, and then we remove most sutures in 10 to 14 days. And many sutures nowadays are absorbable, so they usually are reabsorbed by the body and fall out in 10 to 14 days anyway. So wounds are left to heal by scarring or heal by second intention. We usually recheck them every week to 2 weeks to monitor them, because proud flesh will start to form. And for those of you who don't know what proud flesh is, it's basically the horse's scar tissue ability. And especially on the lower portions of the leg, the horse's body is so prone to producing scar tissue, trying to heal up those wounds and fill up those gaps, that many times that will overproduce, and we'll have to trim that proud flesh back in order to provide a little bit more of a aesthetically pleasing look to the leg and have a little bit better healing as well. So this is a great slide, 2 different wounds, one very catastrophic and the other not so much, but still requiring stitches. And both are on hind legs. So you can see where the one on the left, if we're going to save that horse, he really should probably be clipped, probed, examine the wound, see exactly what structures have been impacted here, which you can see that the flexor tendons are being impacted. Most of the lower part of the fetlock is ripped open, and there's also a wound, a puncture-looking wound above the fetlock as well. So those are dangerously close to joints. They're damaging some significant ligaments in the hind leg, and that might be a discussion for the owner and the barn manager to decide whether or not to move that horse to a clinic or not to. It's a fairly catastrophic wound. And the one on the right is in fairly the same, close to the same location, but is a fairly simple wound. It does need stitches and it will need bandaging because it's on the back side of a fetlock and it's going to undergo a lot of motion whenever that horse walks, but that can easily be managed on the farm. So we'll talk about choke next. So if anybody's not familiar with the phrase choke, it's sort of a slang term. We refer to it as choke, but it really has nothing to do with the airway. The airway is clear. It is not an obstruction of the trachea at all. It really is food material lodged in the esophagus, which is the way that a horse swallows down to his stomach. And so it's sort of like eating a peanut butter sandwich too fast and really having a big wad of peanut butter sandwich in your throat and not really being able to swallow it down. So with horses, commonly they eat too fast or their teeth are not well matched to their diet, which is probably the main cause. So older horses that really can't eat pellets anymore or can't eat hay stretcher anymore, and so they can't crush it well enough and they try to swallow it without it really being well chewed. And then they can obstruct on grass, hay, pellets, sweet feed, you name it. Any obstruction can occur if it's not well chewed or they're eating too fast. And so many clients think that it's an airway obstruction, but even if you hold your hand in front of each nostril, you can usually feel that there's air moving through each nostril. And so sometimes that calms clients down once they realize it's not a respiratory emergency. But it can become a respiratory emergency because the main side effect of a choked horse, depending on how long he's been obstructed, is aspiration pneumonia. So how to tell if your horse is choking. So symptoms of choke are, the primary ones are basically repeated vigorous attempts to swallow, and they usually arch their neck dramatically or they stretch their neck out straight and they physically try to swallow, and then they start coughing right after they attempt to swallow. And usually mucus comes out both nostrils. It usually is fairly gushing, not just a little trickle. And usually you can see food material or hay material tinting the color or giving that mucus some color, whether it's brown from feed material or hay stretcher or green from grass or hay. So the horse usually acts very agitated and uncomfortable, and many times it appears like a colic because the horse was eating, went over to his feed bucket, took a few mouthfuls, swallowed, and then walked away from the feed bucket and threw himself to the ground in the middle of the stall. And most clients would think, oh my goodness, he's colicking. But many times what really happened is he took a few bites of food, he was so hungry, he was eating too fast, he bolted the food, and then it became obstructed, and they feel very uncomfortable, of course, very quickly, and they'll act agitated, and sometimes they'll even roll, but then they usually get up and try to vigorously swallow again. So it's one of the few times where you'll see a significant amount of mucus coming out of both nostrils. Even if there isn't food material tainting it, there usually will be soon. And so it's usually considered a suspect choke until proven otherwise. So what to do while you're waiting for the vet: keep the horse calm and quiet, as calm as possible. If he's outside, bring him into a stall, take all the food, hay, water buckets out. That way you can see exactly what's coming out of the horse's nose, You can watch him closely. You can even massage the neck and throat. We've certainly had clients in the past that have claimed that they could feel the obstruction. It was high enough up in the neck and not down close to the stomach that they could actually palpate the obstruction, and they would massage it quietly and try to keep the horse calm. We encourage you guys not to cross tie them because they really need to hang their head down. That's the best way for the mucus that they are trying to swallow, because keep in mind they're usually in the middle of eating something, so they're still producing saliva, but now they can't swallow it down, and so every time they attempt to swallow, it refluxes back up their nostrils, and we really want that to drain out to the ground. We don't want any of that trickling into the trachea or into the airway because it's typically tainted with food material, and so that would be a foreign body to the lung field, and that would potentially start a case of aspiration pneumonia. So we discussed before, aspiration pneumonia is the primary concern post-choke. So any choke that we see that has already started to mount a fever, we get very concerned about, because now it has become a respiratory problem and not just a swallowing problem. So we ask you not to cross tie them, encourage them to hang their head so that mucus can just come right out, gravity drawn to the ground. Who cares how big a puddle it makes? And then if you have any ACE, or if you keep ACE in your emergency kit, ACE promazine is a very mild sedation drug. We usually use it only for, helping a horse to calm down before loading onto a trailer. But many clients will say on the phone when we are talking with them, they'll say, well, I have a little ACE, should I give them a little bit of ACE? Because that will help them calm down a little bit. And that there's never really a downside to that. So sometimes we'll encourage you to give a dose of ACE while we're driving. Every once in a while, we have a horse that, through attempts to swallow and a little bit of ACE, it resolves on its own when we get there. So they're ready to be okay swallowing under monitoring once we arrive at the barn. So horses that are choked for several hours to days run the risk of dehydration as well as aspiration pneumonia. We certainly have taken tons of calls where, the client found the horse choked in the morning when they went out to the barn, so there's no real way to know how long that horse has been obstructed. So he could have been obstructed all night and refluxing nasal mucus into his nasal cavity and down into his trachea for hours and hours, and obviously that horse would be at a higher risk of developing aspiration pneumonia. So if they have any sort of fever, many times we'll start them on IV fluids and IV antibiotics at the farm. And every once in a while we come across, some minis, very old minis that have hardly any teeth left in their mouth, and they are sort of chronic chokers because they're hungry and they want to eat. And of course, anybody who knows minis knows that they'll eat anything, or try to eat anything. And so some of these are chronic, unresponsive choked horses, and sometimes they have to go to the hospital, sometimes they have to be put under general anesthesia and have that obstructed material plucked away with an endoscope, with the gripping tool end of an endoscope. And so depending on the duration of the choke, we might put your horse on antibiotics, or if he's already starting to mount a fever and the choke's not resolved, he might need to move to a clinic or hospital scenario. And refeeding your horse slowly after a choke incident, whether he resolved on his own or he is resolved now that the vet has examined him and passed a nasogastric tube and resolved the choke, refeeding that horse is a very careful technique. You have to really add warm water. We sometimes just recommend you bran mash them 3 to 4 times, just little, small, soupy, hot meals, just to keep everything going down that esophagus soft, non-abrasive, and easy to swallow, because that esophagus is soft tissue and it's had a significant abrasive injury. And many times they'll re-choke just because that tissue is so tender and still trying to heal. So, gory slides, are we okay? Okay, gory slides. So, eye emergencies. This slide is a little halflinger colt that the other Dr. Jen and I saw basically walked into a dead branch of an apple tree. So everything that's whitish yellow is wood. Yeah. So yes, they are talented. So needless to say, our first suspicion was that it was penetrating directly into the globe of the eye. You wouldn't know that by looking at this horse, but actually it went up under his eyelid. It provided a significant abrasion to the cornea, or the outer surface of the eye, but they were able to save the globe of his eye. We actually recommended this client move the horse to a hospital scenario because we were a little concerned that by just going ahead and pulling the wood, we would start a significant amount of bleeding. So we had to quell that reflex to pull it out, like we were talking about before with the nail in the foot. So we always consider eyes an emergency, or at least an urgency. But the typical sign of an eye emergency is usually your horse is standing there squinting at you, there's tear dripping from the eye, because that's usually coming from a burning sensation that's associated with damage to the cornea. If you guys have ever gotten something in your eye and you've rubbed it and you've rubbed it and you've rubbed it till it's raw and swollen and awful, you know what it feels like. And these guys, they typically rub on the inside of the front leg that's on the same side of their body, and so sometimes you just see the horse and his eyes swollen shut, and the conjunctiva is red and pink and swollen, and you ask the client, has he been rubbing at his eye? And all you have to do is look down at the inside of the front leg, and you can see there's tears and sometimes even blood tinting and drying on the front leg, and you can tell that horse has really been rubbing. Other signs of an eye emergency are eyelids swollen shut. We were discussing those before, or just one eyelid being swollen, or a change in eye color. Horses with uveitis will often have a change to the color of their eye, not really have much damage to the cornea itself, but those issues are occurring at the back portion of the horse's eye. So corneal ulcers are probably the most common eye emergency because they eat hay, and so they put their heads down into a pile of hay, and every once in a while there's a hay strand sticking up, or anything else. A windy day, many times we get a lot of eye emergency calls after a couple of days of heavy, strong wind, because the wind will blow shavings dust, pine shavings dust, and hay dust into the horse's eyes, and they'll then start to rub and cause a corneal scrape. So we tend to address eye ulcers pretty aggressively because on the surface they're typically not infected, but the cornea doesn't have a blood supply. If it had a blood supply, we wouldn't be able to see through it. And so for that corneal ulcer or corneal scratch to heal, those blood vessels have to grow in from the edge of the white portion of the eye, heal the ulcer, and then grow back out of the way so that that horse can see. And the same is true of your cornea. So the cornea doesn't have a very big immunity. It doesn't have any major firewalls to protect it. And so we tend to get aggressive with treating corneal ulcers because they require a lot of protection or they will become infected. And when they do become infected, they can become really difficult to treat on the farm. They can become difficult to treat depending on the nature of the horse being treated. And so they can be a very long, drawn-out process of nursing care for the owner. So other eye emergencies include blunt trauma, blunt surface trauma, uveitis, which is inflammation at the back portion of the eye, the inflammation of the iris and the other tissues, eyelid lacerations, which occur magically, and of course they're like CSI scenes. Whenever you see them, you try to figure out how the horse did these things, but you never can. And glaucoma, which you may be familiar with in the human world, is increased pressure in the eye that causes a significant amount of pain. So here's a couple eye emergency pictures for you. The one on the left, you can see how swollen that horse's eyelids are, and we're showing you the pink tissue or the conjunctiva underneath the eyelid and how swollen and puffy and inflamed that is. And that horse, I mean, you can almost barely see the surface of his eye at all. You can barely assess the cornea. So that's where your ice pack from your emergency kit comes in handy, or even just a pack of frozen vegetables from your freezer if you're close to your house. A good cold compress, even with a rag and some snow in it. Winter is good for some things. So those are all handy. And cold compress brings those swellings down pretty quickly, as does even just 5 cc's of Anamine. Many times we'll have owners give Banamine while we're driving, so that by the time we get to the barn, at least we can separate the eyelids and assess that globe of the eye and make sure that the cornea isn't damaged. Check and see if the bulk of the trauma is just soft tissue, it's just eyelid and not involving the globe of the eye. The horse on the right, his eye is actually ruptured. So that's a far more severe damage than the horse on the left. So once again, what you can do while you're waiting.
So he lost his eye?
The horse on the right, yeah. So his eye got enucleated. That's what we call the surgery, where you remove the entire eyeball. And horses do fine.
You said it ruptured from what?
Puncture wound.
Oh.
So yeah, acute trauma, puncture wound. So what you can do it while you're waiting. Once again, we just talked about the cold compress. If you can, some horses won't let you touch the eye, and they need a little sedation first once the vet arrives to allow you to even use a cold compress. Banamine decreases, once again, we talked about the fact that it's stronger at controlling soft tissue pain. So Banamine brings down soft tissue swelling pretty quickly. And then triple antibiotic ophthalmic ointment, which we have a tube of in our emergency kits. There's never really a downside to applying that. Even if it's not infected, just covering the cornea, even if you just suspect that there's a corneal scratch or corneal ulcer and you're waiting for the vet to come, or you're going to have the vet come first thing in the morning, there's not really a downside to applying a triple antibiotic eye ointment. There's nothing but good can come from that. So yeah.
I have a question, because I think that's one of the most difficult things for me anyway. You don't do it that frequently. Can you describe how the best way to apply triple antibiotic ointment or something, how to get it into the eye?
Has to be ophthalmologist.
I'm always
Right.
like, you know?
I know. So I find, number one, that these things, winter really plays havoc on eye ointment. So I walk around, if I'm going to apply an eye ointment to a horse during that farm call, I walk around with it in an inside pocket, because that ointment gets so cold so quickly. You could stand there at the horse and you'll be squeezing that eye ointment so hard and nothing will come out. So keep them very warm if you can. And then I tend to use my thumb to lower the lower eyelid, and I just put a strip in the lower eyelid, really. And then I just sort of massage the eye a little bit, so I'm sure that it's not just sitting inside the lower eyelid. But, and I always get the question as well, can't you just use Neosporin or triple antibiotic ointment, wound ointment, in the eye? And you probably can, except that it doesn't have an ophthalmic tip. So most clients have to put a strip of that on their finger, and then they're trying to roll the eye open, and then they're trying to get it off their finger into the lower lid. And so it's certainly not as easy to apply, although maybe it's a little cheaper. Or if you don't have an ophthalmic ointment in your kit, or you made your own emergency kit, it's certainly a good plan B. But the hardest thing about getting Neosporin or triple antibiotic from the store and applying it to your horse's eye is getting it off your finger into the horse's eye.
I'm always afraid to use. I always want it on my fingers. I'm afraid of pointy.
The tip, right,
Yeah.
because the tip is not ophthalmic, so the edges are sharp because it's a flat surface when you take the top off the tube. Right, so I'm always concerned about that too. So most of our clients put it on their finger because they're worried about that, but then getting it off your finger into the eyelid is sometimes makes it mission unaccomplished. So, but you certainly can use it in a pinch if you can get it into the horse's eye. And make sure it's not the one with pramoxine, like the Neosporin with plus pain relief. The pain relief is usually pramoxine, and I don't think that you can use that topically in a horse's eye. So you have to make sure it's just plain Neosporin, not the one with pain relief. So last topic is colic. Definitely a couple gory slides coming up, so spoiler alert. So probably our most common emergency call, and colic, as you all may know, is referring to any abdominal pain. Any abdominal pain. It can be coming from kidneys, it can be coming from urinary tract, it can be coming from pregnant uterus. Obviously, most commonly the odds are that it's coming from the intestinal tract by sheer nature of volume. So, and we sort of categorize causes of colic into two, one being medical colic meaning we can treat it on the farm typically with all the diagnostics and treatments we have available to us, or surgical colic, which really just requires a surgical correction. And there's nothing really to be done on the farm unless the decision was made for euthanasia. So causes can be anything from gas distension, bloaty, crampy discomfort, to impactions, which are basically constipation style colics. They're horses that aren't drinking well enough, and that manure is just not moving. It's stagnant. It's become firmer and harder and painful. And obviously we get into the more surgical causes, which are twists, where loops of intestine are twisting on each other, causing kinks, and displacements, where large loops of intestine with heavy amounts of manure inside them have flopped to the wrong location, and so they're sort of providing a heavy weight where they shouldn't have been located in the first place. And those locations can be kinked off as well, so that manure can't get out, and so those tissues can, the walls of the intestinal tract of those locations can just dilate and dilate and dilate and stretch and cause pain from stretch receptors. So aggressive medical colics that we would treat on the farm, for the most part, are impaction colics, horses that are generally dehydrated. We see them many times in the winter because it's so ridiculously cold, and maybe the water trough froze for a few hours. And so that horse just isn't drinking as well. We've certainly read plenty of studies where horses will drink a larger volume of water, and it requires a larger volume of water to slake thirst in the brain if that water temperature is higher. If that water temperature is 40 or 50 degrees, as opposed to being ridiculously cold winter water tank outside. It takes a very small amount of very cold water to slake your thirst than it does of lukewarm water. So we have many clients that when their horses come in at the end of the day, their water buckets are filled with hot water out of the tap, and they love it. And obviously it's not coming out of your tap hot enough to burn them, certainly not on a winter day. And sometimes that's a really good colic preventative, just at the end of the day, getting them super hydrated with an afternoon tea, and then they get dinner. And we certainly have plenty of clients in the room that feed every meal their horse gets with water in it. Every single meal is either oatmeal consistency or soup, especially in the wintertime, because it's a great colic preventative as well. So the medical colics that we see, we tend to pass a nasogastric tube after we've done a physical exam, and that nasogastric tube is being passed from the nostrils of the horse all the way down to the stomach. And that's not just used as a treatment option. We also use that as a diagnostic tool. Horses cannot throw up, they can't vomit, they can't burp. And so many times if a horse has an inflamed intestine and is building up a stomach full of disgusting fluid that you or I or our kids would have thrown up hours ago, they have no outlet for that until we pass a stomach tube. And sometimes that provides them a significant amount of relief, because that reflux is allowed to come out our stomach tube onto the ground and basically deflate that stomach and make that horse feel better very quickly. And so we often use that nasogastric intubation as a diagnostic tool and not just a treatment option. If that horse is a fairly simple impaction, a dehydrated animal that really needs to get some manure rolling, we'll usually give them a large bucket of warm water, mineral oil to act as a lubricant, and sometimes we'll give them electrolyte powder mixed in with the warm water. So everything basically to hydrate that animal and provide a mechanical lubricant to get that manure coated and easier to remove from the horse's body. And so every once in a while we'll put in an IV catheter, and we'll start IV fluids too if we really feel like that horse needs some aggressive help and really needs to feel better immediately, and not sort of the delayed response that sometimes a stomach full of warm water provides. Sometimes we have to go and recheck that horse later on the same day and tube that horse again and give it even more warm water and electrolytes. And sometimes we have to see it, numerous times before that horse really starts producing some manure, the appetite starts to come back aggressively and really starts to pick up and get back to square one. So another cause of colic is inflammation in the intestine, so enteritis or colitis. Entero referring to the small intestine, and colitis referring to the colon or the large intestine. And so that's more of basically a colic caused by, to put it in human terms, like an inflammatory bowel syndrome, or even food poisoning. You know, an acute inflammation that's causing severe pain along their intestinal lining. Whether that ends up producing diarrhea or not, sometimes they don't. Sometimes they're just producing a huge amount of discomfort and pain and fluid building up back in the stomach or back filling. But they will show significant signs of colic. Many times they will have a fever. So while you're assessing your horse and grabbing your cell phone and getting ready to tell your vet what's going on, taking that horse's temp is always helpful to give us some idea of whether that horse is potentially having an inflammatory response or basically a mechanical obstruction. And so those horses many times go on an antibiotic as well as some IV fluids, and sometimes we put them on low-dose Banamine daily just to help protect their feet from laminitis.
So if they don't have a fever present, then it's more likely to be, you have to have a fever present for ladder fever. Or
Every once in a while, we've seen a case of enteritis or inflammatory colic where they have not had a fever, but they still respond. Typically, they have some kind of a fever, whether it's 102, which is kind of low grade, on up. Because as you know from having kids, there are tons of bacteria and viruses that can cause an inflammation like that, just basically a viral stomach flu. And so they typically have some kind of a fever if it's
but
viral.
standard infection type of colic will not necessarily.
Usually does not. Usually does not. Right. Because if you think about it, that's more of a mechanical obstruction. Like everything's kind of slowed down, so the appetite kind of petered out. So now nothing's moving. And so that horse is, because he's not feeling great, he's not drinking either, so he's not staying hydrated. And in this kind of weather, I mean, you really need hydration is key. You would think of hydration being key in July, but it's just as key in January. So typical colic signs. Everybody in the room has probably seen one or two on this list. So sometimes it's just as vague as, oh, he didn't really finish his breakfast. You know what? He didn't really finish his dinner last night either. Sometimes it could be that vague, and others it's just, you know, his stall is nowhere near as messy as it usually is, and there's just nowhere near as much manure in here, or it looks like he's been walking in his stall all night, which can be another sign of discomfort. Low-grade discomfort, pawing at the ground, biting at his flanks, laying down, hopping up, not really doing that full body shake to get all the shavings off of them, rolling in the stall. The flamen response is where they lift their upper lip up, and that can be sort of a mild discomfort. It kind of depends on the horse and how stoic the horse is, but we tend to refer to that as a mild discomfort. And acting dull, just acting too quiet, way too quiet. He's standing around outside, he should be walking around. He's not grazing, he's not eating hay whenever I look out the window. So what should you do while you're waiting for the vet? Easiest things to do, and we always use this one first, of course, is to get that horse walking. Get a halter on him, get a lead rope on him, get him walking. It was difficult to do this winter, because there's just no safe place to walk unless you have a cleared plowed driveway or yak tracks on your feet. But we basically do that for two things. One, it keeps you busy. Two, it keeps them busy. So whenever you give a horse a task, they tend to be very task-oriented. If you're standing next to him holding a lead rope, walking him forward, his mind isn't quite on that colic so much as it is on them making sure they're not stepping on your feet and moving forward because you asked them to move forward. And so it kind of gives them a mission, a mild distraction. And it does for you too. And take your horse's temperature. Usually a horse with a fever, I've had tons of clients call me and say, my horse is colicking, can you come? And I said, well, what is he doing while I'm getting my boots on and grabbing my coat? And they say, well, he's just kind of picking at his hay. And his food is sitting there in his bowl. And I say, well, can you just take his temp for me while I get out to the car, and then I'll call you back. And they call me back, and lo and behold, he has 104 fever. So horses that have a fever are so quiet and lethargic, and they just don't look right, and they're dull, and they're just not really bright at all. And many times they won't touch their grain, but they'll pick at their hay. And if they're outside, they'll usually graze, because who can turn up grass? So, many times if I have a client who says, well, he's picking at his hay, but he hasn't touched his food at all, many times that's not a colic, because with a colic, they really wouldn't be even picking at their hay. So in horses with a fever, that feed is just too heavy on their stomach. They just won't usually eat. And so take your horse's temp. If he truly is colicking, he probably won't even be picking at the hay much at all. And if he is, sometimes they'll eat a bran mash while I'm driving to your barn. A horse with a fever usually won't have much of an appetite at all, unless you bring them outside to the grass, in which case they might eat a little bit. But we usually ask you to hold off the feed unless the vet tells you on the phone, oh, if he's picking at hay, why don't you go ahead and make him a mash and see if he'll eat that. And then eyeball the stall. Is there any manure? What does the manure look like? I know that sounds gross, but kick it with your boot and try to see if it has a lot of liquid to it, or if it's really dry and marbly and tiny compared to the size of the horse. Those are all indications of how hydrated that horse is. That is the most accurate way to tell how hydrated your horse is. Not by pinching the skin on the side of his neck and counting how many seconds it goes down, it takes for it to go back down. Because that's very age-related. That's not a good indication of really how hydrated that horse is. The job of the large intestine is to recoup water. If that horse is dehydrated, that large intestine is working overtime to recoup every ounce of moisture out of that manure before pushing it out of the body. And so if the large intestine is working overtime to recoup water, then there's not enough water in the animal. So get some idea. Any of these things help us formulate a plan while we're driving, whether you're 10 minutes away or 10 hours away. It doesn't matter. If we can help have all that background information, it just helps us move faster when we get to your farm. And then depending on how long it'll take a vet to get to your farm, we might tell you to administer Banamine unless you've already done so. Sometimes if you have access to any other pain control medications, such as mild sedation drugs like ACE or xylazine, which is another mild sedative, sometimes those can provide some pain relief on the order of the difference between Advil and morphine. Sometimes if a client tells me, well, I already gave him 5 cc's of Banamine, and I gave it right in the vein, and it hasn't touched him, he's still trying to throw himself around, and he's shivering, and he's shaking, and he's breaking into a sweat, then I tell them, well, that sounds like it's not a job for Banamine, which is just a non-steroidal anti-inflammatory drug. You need something stronger. And so xylazine or Rompin is sort of our next, our plan B choice, because it's a mild sedation drug that also has pain control tendencies to it, kind of like adding some morphine to your Tylenol. And so some horses do require a little bit of a sedation drug to get a hold of that pain and really calm them down and allow them to walk with the owner so that you can prevent them from dropping and rolling and keep them up on their feet till the vet can get there and assess the situation.
So if you say give them the xylazine, how much do you give them?
Depends on the weight of the horse. So if we're talking about average 1,000-pound horse, we usually give anywhere from 1.5 cc's to 2 cc's. It also depends on how far away we are. So, yeah, usually anywhere 1.5 to 2 cc's.
Wow.
And
How long does that effect last?
it all depends on the pain. If that pain is dramatically significant, that tends to point more toward a surgical necessity for that horse, a twist or a displacement, because that type of pain is so unrelenting and mortal that if that Banamine hasn't touched them and we've given some Rompin, and that's only lasted a half an hour, and I'm an hour away, and they're giving a second dose of Rompin for me to get there, those spans of time in between those doses of sedation are also, they can be a prognosis indicator. They can tell me how bad that horse is and whether, as I'm driving, that client should be hooking the trailer up to the pickup truck. and making a plan for moving that horse to a hospital situation, because that would be a pretty dramatic sign of pain and likely a surgical colic as opposed to a medical colic. And sometimes the old therapeutic trailer ride works anyway. So sometimes you get them on the trailer, go around the block, and come back, and you have a different horse. So every once in a while that happens. So our typical colic exam is a physical exam. We mentioned before things you can tell your vet on the phone. Mucous membrane color. So you lift your horse's lip, and what do his gums look like? Are they pink? Are they purple? Are they scary looking, beet red? What's the horse's temperature? We'll listen to the intestinal sounds. We do have some clients that are pretty good at listening to intestinal sounds too, and listening for gurgles and noises. Heart rate can be a great indicator of how dramatic that pain is, and or how sick that horse is, or how dire that situation has become. And then we usually do a rectal exam or a physical exam internally, where we're basically feeling for a twisted loop of intestine, and many times all we feel is armful after armful after armful of loop of manure that has hard, small marbles of fecal matter in there. We're basically assessing a likely impacted horse. These manure balls should be large and soft and moist, and they're not. And so this horse is likely pretty significantly dehydrated, and this is probably a case that we could manage on the farm, a medical colic. And then sometimes when we palpate these horses, we feel a mass. If it's a 28-year-old horse and we're feeling a fatty tumor that has sort of wrapped a loop of intestine and kinked it off, then sometimes that's where we have to have the difficult discussion of, is this a horse we take to surgery? Is this a horse that we say a heartfelt goodbye to? And so sometimes that rectal exam can give us a lot of information on what we're dealing with, and whether we can keep that treatment on the farm, or whether we need to move to a clinic if that horse is a medical colic or a surgical colic. And then we pass a nasogastric tube like we described before, so we help to try to decompress that stomach of any gas or fluid that's in there, try to provide some immediate relief. And if there's nothing we can empty out of the stomach or flush out of the stomach, then we go ahead and pump in some warm water, some mineral oil, some electrolytes, and try to get that horse feeling better quickly. Many times you're correcting some even mild measurable form of dehydration. So all those horses get warm water whether they need it or not. Kidneys are smarter than us, so they'll excrete whatever they don't need. So other things we might do on the farm are abdominal ultrasound, or a belly tap, and try to get a fluid sample from the abdomen and try to get some idea of whether there's a peritonitis or infection in the whole abdomen, as if a loop of intestine has ruptured and caused a very acute surgical and sometimes a euthanasia decision. And then blood work, of course, we might draw some blood and run the CBC, or check the electrolyte status on that horse, get some idea of the extent of that dehydration, and whether we need to correct some significant electrolytes with IV fluids. And sometimes we'll give that horse calcium in the IV fluids to try to help stimulate that motility, the gut motility. So after that exam, obviously we'll have a discussion as to whether or not this is a fairly simple medical treatment colic, and we'll treat it on the farm, and this is what we need to do, and we might need to recheck this horse later on today. And sometimes that horse will need to be monitored pretty closely, and it requires a fair amount of nursing care. And in the dead of winter, sometimes that's a big commitment. And if that horse is a surgical colic, we oftentimes need to move fast, and we need to dig up those trailering phone numbers, or send somebody to start shoveling out the hitch on the trailer and try to get all that snow away and hook it to a pickup truck. So sometimes there's a fair amount of logistics that needs to work really quickly. Then of course there's the bubble wrap horses. So we're perfect in every way. So does anybody have any questions?
You talked about the varying colors on the horses.
Yeah.
What does a bright red one mean versus a purpley one?
So So usually your typical gum color is the same as you or I, it's pink and it's moist. So if you lift your horse's lip up and you basically touch his gum with your finger or your thumb, you want to feel a moisture there, and you also want to push on the gum and see that color come right back as soon as you take your thumb away. So in some horses that are very dramatically sick, so horses that have the inflamed intestinal tract, whether it's small intestine or large intestine, basically an enteritis or an inflammatory colic, those horses, sometimes you'll lift that lip and see the gum color and it'll be purple because they're so toxic, they're so sick, and they're so septic because that bacteria has crossed the gut wall and is in their bloodstream, that those horses, sometimes that gum color is pretty scary. And sometimes that gum color is telling you, for example, if it's a 28 or 29-year-old horse, that, this is really significantly sick horse and it might be time to say goodbye. And so, yeah, those gum colors usually are pointing toward how sick that horse is, how septic that horse
The
is.
purple being the most
Yeah,
damaged.
dramatic, right, dramatically toxic.
And is there any foul breath that comes into play on any of this? No?
Not usually. Just on occasion, I've come across a horse that was so colicky that as soon as I got to the farm, I could see that, like, I barely had to pass a tube before so much fluid came out his stomach that it was actually leaking out his nose. Like, there was so much pressure in his stomach, like, even though they don't have the reflex to vomit, that it was actually leaking out. He was actually leaking out his nostrils. So as soon as I passed that stomach tube, it came gushing out my tube. So, yeah, those are the horses that as soon as you empty that stomach, they're just so much more comfortable, no matter how much Banamine they just had or how much sedation they just had. Just the fact that you just decompress their stomach provides a huge amount of relief. And then sometimes that's the first thing you need to do before you do any other physical exam. Empty that stomach, leave the stomach tube in, and then get his heart rate, get his temperature. Because when you walk onto the farm and you smell that smell, it sort of dictates how you need to rework the protocol. So.
And what about gas colic? Where in the system is that typically taking place? Is it one place? Is it several places? And how do you?
So that can be. So gas colic is sort of like a crampy, bloaty discomfort. And we've had some clients' horses in the practice that are cribbers, and so they tend to be gulping little air bubbles when they crib. And so those horses we get an increased number of phone calls about, except that they sometimes are fairly simply correctable. Like sometimes they'll correct quickly with a few big dose syringes of Maalox, which is another great item to have in your emergency kit. Because just sometimes stomach soothing, as soon as they drink a dose of Maalox, I don't know if you've ever tried it, but it works on contact. And so as soon as they swallow it, it starts to burst bubbles, it starts to decompress, and it lines the stomach and coats the stomach and calms down.
So that gas colic is taking place in the stomach?
Sometimes stomach, sometimes small intestine, but as soon as they drink liquids, it passes through the stomach pretty quickly. So on cribbers, sometimes that's the first question I ask the client, is your horse a cribber? And then as I'm driving, sometimes I'll have them give a few big dosing syringes of Maalox until I can get there, and or Banamine, but sometimes the Maalox works faster than the Banamine. So some of those horses correct before I get there, but when I get there, they're standing outside in the driveway eating grass, or they're already eating hay by the time I get there, and you know that spasm, that bloaty, crampy feeling is sort of decompressed.
With the Maalox, is there too much? Can you give them too much?
It's not really too much. I usually tell people to give 2 dose syringes. My hands are kind of small, so I don't really fill them to 60 cc's. I usually fill them to 45. Give 2 of them, walk up and down the driveway a few times, give another 2 dose syringes, walk up and down the driveway. But the good thing about Maalox is it works on contact. So it's pretty quick to start decompressing gas bubbles. When I first came to the practice, so long ago, Digel was out, and Digel was the best thing ever, which, you can't really find it anymore. But that was the best, that worked even better than Maalox did at bursting bubbles on contact. And so it really, sometimes those bloaty gas colics correct pretty quickly. And we've certainly had clients call and say, are you still on the way? I'm like, yeah, I'm halfway there. They're like, maybe it's okay if you go home, because now they're just snorting their hay like it's going out of style. So sometimes they just correct minimally. It's just a matter of passing that gas bubble through, and they just correct on their own, sort of like those mild chokes we were talking about before. Some of them correct before we get there. And, you know, sometimes we still insist on coming to see that horse because we know that horse is a chronic colicker, or we're a little worried about driving all the way back home and then getting another call in 2 hours. So it all depends on whether, you know, you call off the farm call or you still have the vet come anyway. Just look over the horse and make sure it was a one-time fluke. Questions? Anybody else? That was a really long answer.
Any causes of repetitive choke that are not related to
Oh,
food?
yeah. Let's talk about
What are the possibilities there with these older guys in particular?
So let's talk about other causes of choke. So probably the most common, I put the most common one on there as being eating too fast. Because, and that's usually a pellet thing. And for example, at Ann's property, there's what, 8 or 10 or 12 horses all turned out together. So you know that there's a high man on the totem pole and there's a low man on the totem pole. So for me, those are the two to watch, because high man on the totem pole will inhale his food and go micromanage everybody else. Low man on the totem pole will inhale his food so he doesn't get micromanaged by the other 9 horses above him on the totem pole. So for me, those are the 2 horses to watch carefully, because those are the ones that are going to bolt their food quickly. And if you ever have a horse on your property, whether it's yours or someone else, who you just see eats dramatically fast, I mean, there are ways to work around that and provide obstacles in the feed bucket. You can take the salt bricks and smack them with a hammer and crack them into pieces so that the horse has to work around the salt brick to get all the food. There are ways of slowing them down to be a little proactive about preventing choke. And the other way is the obvious mechanical way of adding a bunch of hot water to it and make it soupy, because that has to slow them down. Because now there's really only a little bit of actual chewing involved, and the rest is just sipping. And then occasionally we have the geriatric horses that I put in the list of causes, the ones whose teeth and their diet are not well matched, the horses that really shouldn't be on pellets anymore. You know, they really should just be on soaked hay stretcher, or senior feed that's wet down significantly, or they shouldn't be on hay anymore at all. Some horses are pretty smart about chewing the hay and then knowing when to spit it out and take another bite, and they're really not getting much out of the hay. They're just sort of using it for chewing tobacco. But every once in a while you get the minis that, you know, they'll just eat everything, and they just try to get it down their esophagus, and they'll choke and re-choke. And so that's why we place so much emphasis on the dental health of that horse, because I always get the question of how long do horses live? And, you know, probably when I first graduated vet school, that was probably 25, I would tell people, 25, 26. And, you know, the last horse that got euthanized on your property was 39. You know, that has been dramatically changing over the past 10 years, just because clients have been more in touch with the dental health of that horse, and making sure that that horse can eat what you're putting in front of him and eat it well, so that he's not, you know, becoming high maintenance, and he doesn't need to be on 5 meals a day because he can't eat hay anymore, and because 5 meals a day is a lot more man hours that somebody has to pay for, whether it's you and you lose out on sleep, or you're paying staff to do that work. But sometimes that's what they need to remain on the planet until the day we say goodbye to them. They need 4 or 5 meals a day. Sometimes it's soaked hay stretcher, and sometimes it's deep pulp, and sometimes it's senior. But the biggest thing is horses that eat too fast and might need to have obstacles put in their bucket to slow them down, and horses that their diet and their teeth don't match. They can't eat the food they're being asked to eat with the teeth that are left in their mouth.
How common are physical strictures below the mouth?
Well, that's why I was showing that surgical, that endoscope picture of the actual obstruction, because that's our biggest concern with refeeding a choke after a choke, is that many times if that material, that obstruction's been sitting there for so long up against a mucous membrane tissue, it's causing a huge amount of stretch, and then when you remove it, it contracts down. And so sometimes those dramatic chokes do form strictures at the location where they choke. And then from that point on, they're prone to choke at that site because now that site doesn't stretch. It's scarred in a little bit. And that site doesn't stretch the way the rest of the esophagus stretches. And so once a horse is choked, we do watch them pretty closely for a while after that and make sure they don't re-choke or become a chronic choke where they really need to have their diet completely reworked. So yeah, it's pretty common, especially in the over 24 crowd. Anybody else?
Would you as a vet recommend a horse owner having a statement on file with the vet saying, I don't want a surgical colic, only treat to this point as
Absolutely.
your horse ages?
Absolutely. And I know that's a difficult topic to talk about, whether because you don't want the horse to leave the property, or because you know your horse won't load on a trailer, or you know your horse can't do 6 to 8 weeks of stall rest after a colic surgery. Sometimes that's the decision maker, and it's not the money. It's that you know that your horse is used to being 24/7 turned out, and you know that the main post-op direction is that this horse has to be now on stall rest for 6 to 8 weeks, and that would drive some horses completely crazy. And if you know that about your horse, then sometimes the decision is based on that and not finances and not logistics. But having a statement like that, even just on your horse's stall door, so anybody can see it, much less with your vet, sure.
And what about colic surgery? I mean, what's the kind of prognosis for colic surgery? Does it depend a lot on age and general fitness and all that
Absolutely,
stuff?
absolutely. It depends a lot on age, general health. It also depends on what the surgery entailed. Sometimes, for example, when I explained a displacement where, let's say that a loop of intestinal tract on the right side of the horse's colon is now been flopped over here. Sometimes if they go in surgically and just put it back where it needs to be, and then remove some of the fecal matter and get rid of all that, sort of decompress that area of the colon, they always watch it and make sure all the blood supply goes back to being pink and healthy if it's been kinked off. And then they close the abdomen, right? So that seems to be a fairly non-invasive colic surgery versus a loop of intestinal tract that is completely torsed and twisted on itself, which is kinking off the blood supply and kinked it off for whatever span of time it took for you to get to the hospital. So sometimes they have to resect that valve. They have to cut, reattach, and then hope that a stricture doesn't develop where they just sutured these two ends of valve together, correct? And those horses get very, very closely watched for days because that tissue has stitches in it now, and it has to be forced to stretch a little bit to allow manure to pass. And so that type of a colic surgery takes more surgical time, it's more expensive, and is far more dangerous post-op as they started reintroducing food and making sure that the horse can pass manure past that surgical site, etc. So a simple displacement colic surgery could be anywhere from $10,000 to $12,000. And then what we call a resection, where they resect a loop of intestinal tract, sometimes a very large segment of intestinal tract, that could be $25,000. Yes. By the time that horse leaves the hospital, after days of post-op care and monitoring and IV fluids and antibiotics, of course, before that horse goes home. And so, having an insurance policy on your horse, knowing how far you're willing to go, having a credit card with a zero balance on it that's ready to go in case of that contingency plan, or, these are all the difficult topics to have, whether you're discussing them with your husband or you're discussing them with the barn owner where your horse lives because you're going on vacation and you're going to be out of the country for 2 weeks. It's a difficult discussion to have, but it's always better to have a plan than somebody who has your horse at their barn, with a difficultly painful horse and they're trying to reach you on the phone. And these are tough topics to think about, and digging up trailer phone numbers to save in your phone,
Exactly.
Who has time? But having them in your phone under the word trailer is way easier than trying to come up with somebody's name. So they're just all contingency plans. Anybody have any more questions? Nobody's asleep, are they?
We're listening.
Thanks.
You're watching Lewisboro Community Television, Channel 20.